Thank you. Good afternoon, everyone. So just for those of you who might not be familiar, the Bachelor's of Health Science program is an undergraduate program under CSM, and the Health and Society major within that program, and I'm the director for that program, is really the most closely aligned with community health sciences. So this gives students an opportunity to actually explore health research that's outside of wet lab and purely clinical outcomes type research. So, I'm going to start by thanking all of the faculty who have taken on many of our students in supervisory roles for their research. So they do a practicum research, and then they also do their honors thesis year and various summer research opportunities. So thank you to those who have participated, and you know where to find me for those of you who would like that opportunity as well. So I just wanted to keep this very high level and tied to some of the strategic planning that we did post the first kind of community health sciences retreat that we had 2 years ago. We've had a lot of movement on that through the BHSC program. So one of our challenges within Health and Society is that high school students that we're recruiting into the program don't have a clear vision of what it means to do research outside of a wet lab. They understand what a researcher with a pipette in their hand and a white coat looks like, but they don't understand what population health research or research that's epidemiological or more clinical actually looks like. And so we've had some issues in the past recruiting. That has been one of our focus areas over the past 3 years, and I think we're making really great headway. We have one of our biggest cohorts coming in this year that started in September, and they are exceptional. I'm blown away by the level of maturity in their actual critical thinking. So we're very pleased with how that's gone. So some of that is due to a more targeted kind of marketing strategy, focusing on specific groups within high schools, like social justice clubs. There are even health sciences clubs within a variety of high schools across Calgary, and also making sure our messaging is consistent with our recruiters. So that's been kind of a challenge because the University of Calgary recruiters go out for our entire undergraduate sector and not necessarily having clear messaging around health and society type programs. So as a steering committee, all of the health and society teaching faculty kind of got together. We developed some messaging. We actually piloted that messaging with current students to see what resonated, and so we were able to give talking points, which have been really useful for marketing for the U of C recruiters. So that's been an ongoing campaign. So we keep refreshing our messaging and also trying to create a social media presence, which is a little bit more challenging when you can't necessarily upgrade that every day, but that's a whole other story. We also wanted to focus on linking our undergraduate program with graduate students within CHS. That's been probably one of our least successful strategies over the past couple of years. It's very challenging to offer opportunities for graduate students that are fruitful for both graduate and undergraduates. We've tried a couple of different things. The Leadership for Cheese last year was really gung-ho on the idea. They planned a lunch. Unfortunately, it fell on a very busy time of the year in September for students as they're gearing up for their academics, not very good attendance. So still trying to work with the graduate program to figure out what kind of mentorship opportunities and looking at different models that are available through other universities because there have been other successful programs in other places. Okay, lastly, we've really been focused on identifying the places in our curriculum where we need growth. So with the TRC, with some other upcoming initiatives, we wanted to make sure that our curriculum is really well aligned with our intended outcomes, and really not just the outcomes for today, but really the outcomes that we see coming down the pipeline. So we've had some great success here. In 2012, when I first came on into the directorship with Health and Society, we did a curriculum mapping exercise. So that gave us kind of our baseline to start realigning our curriculum. The past few years has really been focused on taking the findings from that and moving that forward. And so I have to thank a lot of the faculty who have really stepped up, who weren't previously involved with the Bachelor's of Health Science program and came up and made a lot of really significant contributions to Health and Society. So an example of that is that we've now got on the books, so in the calendar with official student registration, a Health and Society senior level course that's labeled Advanced Topics in Social Determinants. And so this is a real response to students' needs, and they've been calling for this kind of coursework to be available. And so contributors like Rita Henderson are going to be bringing in community members with her to give students kind of really their first true introduction to Indigenous health. Lindsay McLaren is going to be co-coordinating that, or co-instructing that course with me. I will be coordinating that small beast. But so she's going to be bringing in more public health theory and really some more high-level thinking around social determinants of health. And Rebecca Haines-Saw is going to bring some of her gender expertise to that course. These are really unique opportunities that only exist because of the expertise within community health sciences and those people willing to share their expertise with our undergraduate students. So that is one of the few courses. We now have an Intro to Epidemiology course, and we've really been able to align some of our other courses. So if anyone is ever interested in even a guest lecture around their particular area, please let me know. We can fit you in a variety of places. Our students are always really, they want to hear the research in action, right? They want to see what this looks like outside and maybe in helping to shape their future. So it really is an opportunity, too, to maybe poach some summer students. So, just throwing that out there. Are there any questions? Huda.
How many students do you have now?
So incoming this year we had 19. So the Health and Society program is capped at 25 because of our capacity for research. But overall we have 64. Overall the Health Sciences program has, I think, 189, somewhere close around there. So we are, by university standards, a small undergraduate program, but it is part of what makes us really unique and makes actually my job incredibly fun. Yeah. Thanks. Okay, great. Thank you.
Thanks, Fabiola.